Okay, I see it's sending to YouTube. Perfect. All right, we can start. Welcome back to NMP Talk Show. Today, I'm so thrilled to host a remarkable person by the name of, should I say, Dr. Leseho, but the name is Leseho Kanzi. She's a doctor and a distinguished medical doctor and a consultant epidemiologist. I've been practicing this word for the whole day and I just can't to get it out. So, everyone, join us as we dive into this insightful discussion that we're going to have about health, beauty, and rich tapestry of Black aesthetics. So, Dr. Leseo Khanzi will share her expertise, her perspective, and she's going to, of course, enrich our understanding on how beauty intersects with wellness and culture. How beautiful is that? So let's embrace this journey together and uplift the voices that define our beauty. So I want to formally welcome my distinguished guest, Dr. Leseho. Dr. Leseho, welcome to the show.
Thank you very much. I'm so happy to be here.
Makes the both of us. Thank you for honoring the invite, and we've been looking forward to having you on the show. Back again on the show. So
Thank you.
um, it's nice to see, my guest coming back to the show. It means I'm doing something right, right?
Definitely are.
I hope so. Yes. So, Doc, today we're talking about aesthetic and African beauty. And I don't want us to waste time on this because everyone has been waiting for the longest time for the show. So let's jump into it. What is aesthetic treatment and how can this be tailored to meet the specific needs and characteristics of a black skin?
Okay. So,
Mm.
aesthetic medicine is actually a field that started a number of decades ago, but it's
Mm.
only really starting to be very, very well recognized recently because of social media and that kind of thing. But aesthetic medicine has to do with health, wellness, and also trying to have the best appearance that you possibly can using the tools that you have. So, aesthetic medicine differs according to different countries and also the different providers that provide aesthetic medicine. So, for example, my aesthetic is really to make you the best version of you, not to change you into somebody else.
So it's not plastic surgery.
No, no. So there's quite a
That's good.
big difference between that
Yeah.
and plastic surgery. So plastic surgery really is where you would have a surgeon who
Mm.
sees either a physical problem or a perceived physical problem, and
Mm.
then the solution would then be surgical. So you have a
Okay.
major scar, it would then be removed surgically. Aesthetic medicine has a lot more to do with things like assessing the patient's health. There are many intrinsic and extrinsic things that lead to us not being the best that we possibly can be. Things like smoking, things like excessive sun exposure, things like not drinking enough water. Those all affect how we look.
Mm.
And I actually would like to slip a quick little study in. There was a
Please go
study
ahead.
recently that
Mm.
was published that shows that beauty actually is not skin deep. It's been definitely proven by science that the better one looks and feels that they look, the better one feels about themselves generally. So it actually improves signs and symptoms of depression, but also, funny enough, it also affects the way in which others perceive you. And you
Mm.
definitely seem to have a better reception by other people if you look and feel the best that you possibly can. So I know that sometimes it seems quite
Ah,
superficial,
yeah.
but this is the world that we live in. We'd like to
Mm.
present our best foot. And yeah, I mean, a lot of studies definitely demonstrate that.
I like how you put it. You say beauty is not skin deep, but it's how you feel and how you carry yourself, right?
Yeah,
And
definitely.
I've looked at people, growing up. who used to joke around with other kids, how they looked and all of that. And then you got to see them grow up, mature to uh, this type of people that have so much confidence despite their looks, but they are so confident that you can feel that they feel beautiful. And that's what you just
Exactly
proven to
that.
me. Yeah.
Exactly that. Everybody is
Mm,
individual. So there's
yeah.
no cookie cutter look for anybody. We
Yeah.
try to make everybody the best version of themselves and what they feel comfortable with. I feel very, very strongly about that, especially when
Yeah.
it comes to African beauty, which I think we're going to touch on quite a bit.
Yeah. Yeah. Sure. And you also touched on the relationship that it has with your mental wellness, because you
Yeah,
can get depressed, right?
yes.
By
So,
how people perceive you.
yeah. So I think the starting point is really how you perceive yourself.
Mm,
If one perceives themselves in a positive way, they will tend
mm,
to then be happier, do
mm.
better in life. But
Yes.
also, that influences how other people then perceive you, which also then influences how well you do in life. But the basis will
Mm,
always, always, always be how one perceives themselves. And how one perceives themselves is not always about looks. Exactly what you said. If you're comfortable in your own skin,
mm.
that's what you exude to other people, you know,
Exactly.
and
And
that's
that's what they
really
will
what you
see.
want.
Yeah.
That's what they will see.
Yeah. Interesting fact. You just proven it. Thank you so much for that.
Thank you.
So, like any other practice or anything we do, we do have misconceptions flying around. So, what are some common misconceptions or myths, surrounding aesthetic treatments, especially
Mm.
for Black people?
Yeah. So, strangely, I actually was at a long meeting this weekend with other aesthetic practitioners
Mm,
talking about exactly that. Back in the day, we all felt that aesthetic medicine was about Botox and fillers. That was it, right?
yeah.
Everybody
Mm,
wanted to have full cheeks, full lips. Everybody looked overfilled, and everybody was Botox to death, where they had no expression on their faces. But things have evolved quite a lot to show that number one has to have an appreciation for the aesthetic that that specific person is going for. So, for
mm,
example, if we look at, I'm black, I'm a black person, so, and black people, we're not all the same. A lot of times we have this misconception of black don't crack. That is not true. Black does crack. So, this is the reason why I will always, always, always emphasize sunscreen. I mean, we live in Africa. We have the
mm,
greatest sun exposure in the world. We need to take care of our
mm,
skins, right? That's the first misconception. The second misconception, which also has been proven by data, is that when you look at the aesthetic needs amongst different population groups, amongst Black women particularly, the first thing that they will be concerned about their looks would be pigmentation.
mhm,
The second thing would then be things like skin quality. And then the third thing, funnily enough, is this money that I'm using for my aesthetics treatments worth doing what I'm
worth it.
doing? Am I not depriving my children, for example, of a better life by removing my pigmentation, my excess pigmentation, for example?
Mm,
You know,
mm,
and I found that
mm,
really quite interesting because that really demonstrates to me how particularly Black women think. The first thing for us
mm,
is always about other people, about our families, which is great. But again, it's really, really important that we invest in ourselves, in things
mm,
like being healthy, but also, again, skin quality. And if pigmentation patches bother me, I see no reason in not addressing the pigmentations, you know. Skin quality is another one, you know. A lot of times people would think that because Black people definitely tend to age a lot slower than
mm,
Caucasian skins do,
mm,
there's no need to be doing any treatments on Black skin. But again, there's so many different aesthetic products that include injectables that are specifically for skin quality. It's not about fillers and Botox anymore. It's about things like biostimulators. It's about hydration, where you actually inject products that originally were developed from fillers, but when they injected in microaliquots directly into the skin by a skilled practitioner, they deliver deep hydration for 9 months in people that have excessively thin and excessively dry skins. I think that's amazing. These are
It is,
products that
yeah.
are biostimulators. These are products that actually help your body to produce new collagen and new elastin underneath the skin. No other product has been able to do that. I mean, you can drink
Wow.
collagen powders by the gallon full, but it will
Mm.
never do that for you. That's why aesthetic treatments have become so important amongst Black people and amongst everybody, really.
So doc, this new procedure that you're talking about, let's say for instance you have oily skin,
Mhm.
but now after taking a bath or shower, whatever, your skin is dry, and
Yes.
then after some time it gets very oily. Would that help in that case, or what's going to happen? Do you need further treatment on that?
So, yes, again, we assess each individual patient because it can happen that, for example, I mean, I can tell you about myself. I have a very oily chin, I have very
Mm.
dry cheeks. So, I would know that if I want to have deep hydration, for example, and I want to use one of those biostimulator products, I would put
Mm.
it more in my cheeks than I would in my chin. On my
Mm.
chin, I would then concentrate more on, just emollient creams, and then again, sunscreen, sunscreen, sunscreen. So it's really individualized according to exactly what it is that we're treating for that specific person.
Okay, all right. Tato on Riverside says, I'm one of those who forget sunscreen and I'm always on the sun. Shem Tato, I think you and I are on the same boat. But hopefully after this show, yeah, we'll remember sunscreens. My wife always draws me with sunscreen. Take your sunscreen. I'm like, no, black don't crack, you know? But yeah, today I've learned black does crack. But if I think, on the Maasai tribe,
Mhm.
they don't have this technology that we're using, but they often have things like on their skin, like ashy kind of thing, paint. I don't know what they call it on their
Mhm.
skins. And now I know why. Because if black didn't crack, they would not have to do it.
Precisely.
So they
You
mastered
know,
it long ago.
yes, back in the day, I mean, we used
Yeah.
to have our own products that we used as well.
Yes.
Not only to beautify, but to make sure that
Mm.
you definitely don't crack. I mean, an interesting fact is that if you look at twin studies, where you have exactly the same DNA, these identical twins. One lives in the southern hemisphere, one lives in the northern hemisphere. So in the
Mm.
southern hemisphere, our cars are right-hand drives, and so we
Yeah.
will have more sun exposure on the right-hand side. You take the
Yeah.
same twin in the northern hemisphere, they will have more exposure through the car on the left-hand side. And you can definitely see that there is more sun damage on the right hand side than there would be on the other side.
That's true.
I think
Yeah.
it's yeah. I mean, sun damage is a huge thing. Sun damage can also lead to skin cancers, for example. We always think that
Mm.
Black people can't develop skin cancers, but we do.
We do,
So
yeah.
we have to take care of our skin. So that would be my number one rule before anybody leaves my practice. Every single day, I'm
Mm.
sure everybody's tired of me telling them, but an SPF 30 plus is essential and must be
Okay.
reapplied every 2 to 3 hours.
Yeah. So how
Yes.
long would that take you, that tube? I mean, last you.
Well, it depends on the product that you buy. I mean, you get really
True.
inexpensive ones, you get expensive ones, but SPF is SPF. We've got to do it.
Yeah, yeah, yeah. I guess for your own sake, you get to.
Hmm.
So let's talk about the trends. What trends do you see, especially for black skin?
Yeah.
that are trending are popular.
So again, before I even talk about trends, I'm very science-based. So an
Mm.
interesting paper again that I read recently
Mm-hmm.
talked about the aesthetic needs and trends that different populations wanted, right?
Yeah.
And it looked at the Caucasian population and then it looked at African populations. These African patients that they're talking about are African American, which I think is very, very different from a South
Mm.
African African, from
Yeah.
an East African African, from a West African African. So this is why it's really important that we also have those same studies being done by us.
Mm.
Us local doctors need to run these studies so we know what our patients need.
Mm.
But in terms of trends, what I'm seeing quite a lot is again skin quality. Everybody's on Instagram. Everybody can see on
Mm.
TikTok all these, what do they call it? Glass skin and Korean skin and glazed donut skin. Everybody wants to have this absolutely flawless skin that has no pores, which is a great ideal. But we need to remember that we live in the world of Instagram and TikTok. There are filters galore. Nobody looks like that in real life. And I think it's very,
Yes.
very important that
Yeah.
we get that across to everybody, particularly really young kids, because that's where we tend to develop body dysmorphic syndrome, right? So that's number one, is skin quality. The other big trend is I'm finding amongst my younger patients, lip augmentation has become quite a big thing amongst Black ladies. So there's always been this myth that we have very big lips, so we never ever need any volumization of the lips.
Mm.
But I found that particularly in my 20-year-olds, early 30s, it's not about making the lips bigger. It's actually about defining the lips and also about injecting the filler in such a way, again, because it's got hyaluronic acid, to give the lips hydration. So that's actually what they call the lip gloss. It's an
Oh,
injectable lip gloss, you
I
know.
need one.
So yeah, we all need one, I would think. So that's the other big trend that I'm seeing. I'm seeing less and less requests for brow lifts, which used to be quite a big trend a few years ago. Everybody
Mm.
wanted the fox eyes and everybody looked strange like an alien. So that doesn't happen so much anymore. Um, but yes, and I think the other big trend that I'm also seeing that I'm not very comfortable with is skin lightening. Skin lightening
Okay.
is a whole other topic on its own.
Yeah.
I do think that there are practitioners that practice it. I personally don't. I just don't believe in it.
Mm.
But skin lightening for me has been quite a big trend that I'm seeing across the world. Whether
Yeah.
it's a good thing or a bad thing is another issue. But yeah, those are the trends.
All right. So if you just joining us on Telegram and Riverside, YouTube, we're talking about aesthetic and African beauty. We spoke about the trends that we seeing online about how to make yourself beautiful, how to treat your skin, and we also seen how we can make sure that our skin pigmentation is being taken care of. And one of the things that the doctor has mentioned is sunscreen, which majority of us are, I think, I stand to be corrected, do not really consider that. And the fact that we have this saying, black don't crack. And the doctor just said, black does crack. And we do have, good examples of other nations that don't use this modernized creams and all of that, but they would have a covering on their skin, so that they protect their skin. So yes, black does crack, so we need to really take care of that. Okay,
Definitely.
doc. Yeah. So if you do have a question and a comment, please raise your hand if you connected on Telegram. And if you're on YouTube, you can type your answer there. I mean your question and comment. It goes the same with Riverside. So I see we do have another message that has just popped in there on our stream. The lip gloss I love. It's the first I hear from it. Can we use collagen product often to enhance our skin?
So
Did you get
yes,
that
that's a
one?
two-part answer. Yes, I did.
Yeah.
Thank you so much for the
Okay.
question. So
That's
the
from
lip gloss
Tato.
is okay. Thank you, Tato. That's the lip gloss is a relatively new concept. I think it's a relatively new term, but it's actually something that we've been doing for a long time. Previously, remember that filler is made of hyaluronic acid. The body makes its own hyaluronic acid anyway in the skin in order to give you hydration. That is how water is able to move between the cells inside the skin. So if you use a cream that has hyaluronic acid in it, then ideally it should be able to feed you with extra moisture. But imagine what bigger effect you would have if you were able to inject the hyaluronic acid directly into the skin, where you know that it uses technology. One of the technologies is called Vicross technology, for example. This is what binds the different hyaluronic acid molecules together so that they stay in the skin for 9 to 12 months and don't dissipate. And that's how it gives you the lip gloss effect. So it's really, instead of making the lips enormous, you use a very, very soft type of filler where you just outline the lips and then you inject tiny little aliquots of the product into the actual lips. And it really does give the lips excellent moisture, that lip gloss look. And I mean, even aging ladies like it quite a lot to volumize their lips because our lips kind of move in as we get older. But that has become very, very popular, this injectable lip gloss. But essentially, it's a very, very soft filler that's being injected. Your second question was about collagen products being applied to the skin. Now, the skin is made up of 3 different layers. So you've got your epidermis, which is quite a hard layer. It's got the keratin sites and the cells in it. And then you've got the dermis, which is where all of your little inflammatory cells come from. And that's where your skin gets built up, right? So that's almost kind of your factory of the skin. And then you've got the subdermis, where you would then find some more of the factory kind of cells, and then also some of your melanocytes, which are responsible for giving you your nice glow and pigmentation of the skin. So if one imagines applying a product with collagen onto a skin where there's keratin on top of it, keratin is like what is in our nails. There is no way that that product is going to be able to penetrate through the skin and give you that collagen. Collagen is formed in the dermis and the subdermis. It's not formed on the top. So unfortunately, yes, you could buy the creams. I'm sure they promise quite a lot. But the science shows that injectable biostimulators will give you that new collagen. I mean, scans have shown it. It's a scientific fact.
So we know accidents happen. If you bite your lip and bleed, do you lose the quantity of what is it? The collagen.
So yes and no. So
Yeah.
if you bite into your lip, your body's automatic response is, I have to protect myself. So the first thing that your body is going to do is it's going to send its little clotting factors and fibroblasts and all of those cells to the bleeding area so it can clot the area that's bleeding and stop you bleeding. Right.
Okay.
The second thing it's going to then do is recognize, okay, I've stopped bleeding, so now I need to heal. So then it's going to send those fibroblasts that are responsible for making new collagen to that area to make it knit together. And it does form new collagen. The body is amazing. So you're not going to lose that collagen unless there's a big defect, a big surgical defect. But the body is an amazing thing. It reforms it.
I guess now this opens up my next question: how important it is for practitioners to have, good enough experience or expertise to treat black skin when offering aesthetic treatments?
Look, I feel that all aesthetic practitioners need to be very well trained. We are doctors. We need to know what we're doing. We cannot be fly by night beauty makers. Aesthetic medicine is a field of medicine. It is scientific, so we all need to know what we're doing. I also do feel, though, that Black patients and patients of color, let me not even say Black patients, patients of color, our skins do tend to react differently to skins where, they don't have that much melanin. And Caucasian skins, we know that, for example, if one gets a little acne spot on the skin in an African skin, yes, the acne will go away, but our body's response to protect us is to form post-inflammatory hyperpigmentation. So to form a little dark spot in order to protect us, right? Melanin is our protective mechanism. In a Caucasian skin, the same acne mark would go away, but it's very unlikely that they will be left with a dark spot. So our body's protective mechanism is also one of the things that kind of bothers us, because at the end, we're like 54 years old, we've stopped having acne, and yes, we have all these acne marks, and nobody wants it. I mean, you're 54 years old, So that's why we would then need to treat that, try and remove it in whichever way it is. I mean, there are many different ways of doing that. It's not just injectables, there are different types of deep and medium peels that doctors would do. There are different types of modalities like microneedling, lasers, all sorts of things. But it is important that your practitioner is experienced with skin of color. It is very important. So don't be afraid to ask your doctor. I think it's an important thing to ask, how are you qualified? Where did you qualify? How much experience do you have with skin like mine? And I think that any doctor worth their salt would not be offended by that. I think it's a valid question to ask. I would also want to ask the same thing if I were going to a doctor.
Yeah. So what are some unique challenges or considerations that arise when you perform an aesthetic procedure on a colored skin?
So the one thing is expectation. There's always what the patient expects and then what the doctor expects. And the two don't always meet. So that's why it's really important that there's a proper consultation. I mean, I book my patients for an hour. Even if the procedure is going to take 10 minutes, I still book my patients for an hour because I want us to talk so that we both know what outcome it is that we both want. Because it does become difficult where, for example, I mean, I've had a young lady who's 21 years old walk into my office and tell me, "Doctor, I would like 2.5 mils of Vollift into my lips, please." And I was quite shocked, because yeah, that's quite a big volume. But also, this is a medical practice. It's not McDonald's. You're not ordering a number 4. You're going to be assessed, and then we can talk about what it is that we can do. So I had to take a step back and ask and say, okay, so hi, I'm Dr. Khansi. It's very good to meet you. I am an aesthetics doctor, and I'd like to discuss what it is that makes you want to have this specific look. And when you ask people questions, you actually need to listen to what they're saying, because in the end, it turned out that this young lady had an influencer that she was following who's really stunning on TikTok. And this is exactly what they had. And so her idea was, if I have exactly what this influencer has had, that is the outcome that I'm going to have. And that's not necessarily true. So that for me is a big challenge. But also a big challenge is also body dysmorphic syndrome. Body dysmorphic syndrome is a condition where our perception of ourselves and how we look in our bodies doesn't tie up with reality. So for example, somebody may think that they have terrible eyes or a terrible nose or whatever it is, but that's not actually the truth. And so their major quest would be to find a practitioner who's going to fix their nose, for example, you know, and they will continue doing that until they get the result that they want or they've had a big enough complication. And when that does happen, I mean, I have experience in that. I think it's really important as a doctor to say, okay, I hear you, but this is where I think we need to stop. It's really important for a doctor to be able to say, I don't think this is healthy for you. I don't think this is good for you. And I don't advise that you do it. If the person then insists that they want to have that procedure done, I will happily refer them to another doctor who will possibly decide to do it, but I won't be doing that.
Okay. That's humanity there. That's kicking in.
Yeah.
It's comforting to know that you're also thinking about the health complications more than the financial gain for yourself. I mean, this is also a business, you know. The more clients you have, the more you can live off the business. But if you take away the humanity in it, this is where it goes wrong. And that for me instills confidence in you. I mean, I've known you for quite a number of years now, and I'm that confident, to recommend you to anyone else. And just you saying this now also, cements that.
Thank you
So
very much for saying that. But
yeah. Mhm.
many doctors do that. I think it's very important because we need to remember that it's not primarily a business. We are doctors. We are seeing
Mm,
patients. You know,
mm,
the business comes along with that, but we are doctors.
yeah, yeah. If you keep that in mind, you go far, further than you are
Exactly.
now. So, are there any specific aesthetic treatments that you can recommend for black skin?
So, first one, before
Mm,
I know I'm going to sound so boring, sunscreen. Okay, now that
mm.
we've gotten that out of the way,
Yeah.
I always I always recommend things like when you're entering, into the aesthetics world, do your evaluation, look at your skin, see whether, you've got an even skin tone, whether you've got perhaps little acne scars, that kind of thing, because then that would determine what kind of treatments I would recommend. So, for example, in a young lady who's got acne scars that we need to treat, then it's
Mm,
possible that I would then recommend things like microneedling, or possibly even injecting different types of filler into the different scars in order to treat that. In somebody who, for example, has a major scar, I actually recently had a very nice lady who was in a car accident, and she had this huge scar on her forehead, and so she ended up always walking in with a hairstyle with a fringe on until I asked her,
mm,
what's going on? And then she showed me her scar. And there are so many different treatment modalities that we can have for scars for Black people, because it's important to realize that Black people we are more prone to having what we call keloid scars. So keloid scars is an overgrowth of scars. So again, our bodies try to protect us so much that they make our scars overgrow. And as I've said, there's a much higher rate of that happening amongst Black people than it does amongst any other population group. And so, in such a patient, for example, you would know, I wouldn't start off by being aggressive. Perhaps we would need to inject a steroid into the lesion and see and wait. This is something where you actually have to say to your patient, we're going to walk a path. It's not going to
mm,
be a 2-month thing. This is
mm,
probably going to take us 12 to 18 months, but I'm going to walk this path with you until we get this right. If we don't get this right, we will find somebody who will get it right, but we will get it
mm.
right.
Thank you for that. Would you have a comment there? I don't know if you can see on your screen. What about the treatment creams that we get from GP for eczema and it won't go away? Do we have alternative we can use in the meantime?
Yes, yes. So, firstly, full disclosure, I'm an epidemiologist and aesthetics doctor. I'm not a dermatologist. So, that kind of does fall into the field of dermatology. But what's important to know is that yes, GPs, we are trained in how to treat acute eczema when it's happening. The problem with eczema is it's an inflammatory condition that tends to wax and wane. So it is going to come back. And what often happens is we tend to prescribe steroid creams that are going to make the patient feel better very, very quickly. But if these creams are overprescribed or used for too long, they also tend to make the skin excessively thin. They reduce the skin barrier that's there. They also cause increased blood vessel formation in that area. And then you find that because there's no barrier, then you're going to be prone to having these things again and again more frequently than you would have had you not treated initially. So, yes, there are alternative treatments. There are steroid free creams that many, many doctors prescribe, whether they're GPs, whether they're dermatologists. And it's important for us to always say to our patients that this is not going to give you the immediate relief that you got from your previous steroid, but long term, this is going to be better for you. And once you get that buy-in and we all understand what we're talking about, people really do improve. But yes, there are alternatives.
All right. Tado, I hope you are answered there. Let us know if you need further clarification on that. You touched on darker skin tones, you know, hyperpigmentation or
Mhm.
scarring. So, how can individuals with dark skin address those concerns?
So again, sunscreen helps to prevent it.
Mm-hmm.
But one of the big concerns that we always have, especially as women, is post-pregnancy, we tend to develop melasma, those patches of what we call the chubaba, where you just
Mm-hmm.
have these dark patches and they just happened because it was a hormonal issue, you had a baby, and they're very, very difficult to treat. Again, it's important that the skin is assessed to make sure that there's no inflammation. If there's inflammation, the inflammation needs to be treated. If the person needs, for example, chemical peels, then that needs to be done very slowly, being reassessed. It also does depend on the type of post-treatment regimens that they're going to be using in between. But yeah, post-inflammatory hyperpigmentation really is a problem. I mean, worldwide, that is our biggest concern as people of color. It will always be
Mm-hmm.
post-inflammatory hyperpigmentation.
Mm-hmm. All right. Thank you for that. If you're connecting now, we're talking about aesthetic and African beauty. And if you have a question or comment, you're more than welcome to join into our discussion. Raise your hand there if you're connecting on Telegram. And if you're connecting on YouTube, you can always type your question like you can do on Riverside. So, Dr. Kanzi, we've discussed a lot of things today about aesthetic, and I think we have a better idea on how to deal with these procedures, and also confidence that we have doctors such as yourself that can administer these processes, and we're really grateful for that. But now we can move from that understanding. We also have cultural backgrounds or personal preferences um, that can affect our decision making when it comes to seeking aesthetic treatment. How can we address these ones?
So all of us, I think, come from different backgrounds. We have many different cultures in South Africa, in the wider
Mm,
area of Africa. So it's always important, again, to have that good doctor-patient relationship, to discuss it with the patient, to see what is it actually that bothers you. You know,
mm,
You can have somebody that has an issue with the fact that, I don't know, they want a pointier nose, for example, and I mean, the genes just don't allow them to have a pointier nose. I often discuss it with people to say, what is it about a pointier nose that you think you're going to get? Why do you want this pointier nose? What's going to happen once you have this pointier nose?
The looks.
But that's the thing. That is the thing. It's not necessarily the case, because, there are so many complications that can happen by putting filler into a nose or putting a thread into a nose. And that may not necessarily be the best look for your facial proportions, So there are many other things that a practitioner can do that kind of fit in with that person's cultural norms, for example, but are not going to change who they are. So, for example, not too long ago, I had a young lady who had just recently gotten married, but in her tradition, she had to cover her face or the bottom of her face. And she walked in and she said she wanted lip filler. So I said, okay. And her husband was sitting in the waiting room. I said, so how are we going to do this? Because obviously your husband is going to notice that you're going to have this lip filler. Does he know? And she says, no. So I said, so what are we going to do? And for her culture, it was completely acceptable that she could then have this procedure done, cover her face, the lower part of her face. Her husband would never have known anyway, and she carried on with life. So I'm not saying that we need to deceive each other, but what I'm saying is it's very, very individualized,
Yeah.
So culture is always a fluid thing. Never ever assume that a 78-year-old grandmother is not going to decide that they want Botox, because I have many, very many of them that decide that they're tired of these wrinkles. And so that's why I'm saying culture is completely fluid. It's completely individualized.
Yeah. All right. No, thanks for that. Earlier you mentioned that the studies that are prevalent now are talking about black skin from the United States part, the America part, not more of us here in South Africa. And looking at our climate is different to other, climates. So, do we know if there is? Yes, you said there is a study that you are doing. Is it a full blown study that is going on, or it's just a study that you personally are carrying?
So the study that I'm doing is a multi-center study amongst a number of different practices, and we've got the same inclusion criteria. So we're including the same type of patients, we're evaluating them in the same way, and we're actually going through the numbers to see what our results are showing. But there's also a bigger study that is being started, which is even bigger center, which is going to involve a number of universities as well, because we think that it will also be easier to be able to recruit patients amongst university students, because they would be living on campus. So it would be easy to follow somebody up and see if there was a complication or something like that.
Okay.
There's also quite a nice paper that was published on patients that were at SMU, at Sefako Makgatho University, and on what African beauty means to them. And it was so interesting to see. I mean, this was published maybe, I think, 4 or 5 years ago. And it was so nice for me to see that it wasn't about being a yellow bone and having a pointy nose and having long hair. People were talking about, I would like my skin tone to be even. I would like to glow in my darkness. I would like to emphasize my natural features, be the best that I can be. I was so impressed by that. And those were
Wow.
university students. So, I mean, if these are the people that are coming up, oh my gosh, African beauty can only get better, because then we become more ourselves.
And And African skin is beautiful, guys. Yeah,
Beautiful.
it is beautiful. Yeah. All right. We have another comment there from Tato. Tato is really enjoying herself here. She says, I just need a lip filter, clear skin with one color, no freckles or tags. I think I have freckles on dark skin. Is it possible? We grew up thinking only, okay, what happened there? Thinking only light skin can have freckles. Can they be removed?
Dark skin definitely can have freckles. I personally think freckles are very, very cute. I have had patients that would like to remove them. Yes, it is possible to remove freckles.
Mm,
But also, some of these things are things that you were given naturally. Rock your
mm,
natural features, emphasize your natural features. So I do agree in having even skin tone, because obviously if you look at light, and you look at a very, very flat surface, a very flat surface is going to reflect the light in a very, very even way. And
yeah.
that is what the eye sees. And so that's the reason why somebody would then see this as a better skin, because the skin tone is more even and there are less pores and all of that. And it would be more glowy, because glow is the big thing at the moment, right? But some of our natural features I feel are a good thing. Yes, freckles and
Mm.
things can be removed, but I think freckles are actually quite cute.
Tato, can you hear that? There, she's laughing about it. So, where can we find you, doctor?
So I'm on the socials. My Insta handle and Twitter and Facebook is Dr. Lesego Khansi at Rain Aesthetics Medical. So if you just look for Dr. Lesego Khansi, you'll find me. I post quite a lot on Insta, some of the trainings that I do for other doctors, some of the presentations that I do. I also, for patients that allow me to show some of the procedures that we've done, I also do post that. Obviously, it has to be
Okay.
in a respectable way so that we don't identify patient features. But yeah, that's
Mm.
where I am.
Right. Tabo is grateful there. Um, let me. So no question, just a comment to say thank you for this episode. Thank you, doctor. I mean, I think she speaks for a lot more ladies that are connected. That they're very grateful of it. We do have a comment on Telegram. Sino, welcome to NMP Talk Show.
Hi, Brother Neil. Hi, Dr. Kansi. Thank you so
Hi.
much for doing this show. I especially I appreciate that it's focusing on African beauty because, like I'm sure it's been mentioned, I joined a bit late, so I'm not sure if what I'm about to ask has been talked about already.
Mhm.
I have an autoimmune disease slash lupus, and I'm always, worried. I'm 36, and I've started thinking about collagen and all this hyaluronic acid, and I'm just like, if I get injections like that or any kind of aesthetic treatment, do I have to be concerned as someone with this disease? You know, are there things I should probably like stay away from, or I've been curious about that. So I just wanted
Yeah.
to ask that question.
Thank you for that question. That's actually a really, really important question. It's a topic that we didn't address. People
Mm,
with autoimmune diseases, it's super important to ensure that whichever autoimmune condition it is, for example, lupus, is fully under control and has been fully under control for at least between 6 to 12 months. Because what can happen is if one injects, for example, a biostimulator, as it says, it's a biostimulator, so it's going to stimulate your own immune response. But in somebody who's got an autoimmune condition, your own immune response is already a problem. It's hyperactive. So it may be contraindicated. It may not be a good idea for those specific products to be injected into somebody with an autoimmune condition. So super important that your doctor consults with you properly, right? But in terms of things like, for example, toxin, muscle relaxants for wrinkles, those shouldn't really be a problem unless there's an actual problem like myasthenia gravis, where somebody has a problem with, muscle movements. But in terms of autoimmune conditions, if those are fully controlled and, the person is doing well, by all means, things like toxins can be done under good guidance. But there are some treatments like your hyaluronic acids, like your biostimulators, which are not a good idea.
Thank
But
you so
also,
much.
having said that, I do want to give you a little bit of hope, because we all want to age gracefully, right? So that means
Yes.
that you would still be available for things like energy-based devices, where we'd be able to still be able to plump up the skin and create that new collagen, but without actually injecting something that could be harmful. There would be things like microneedling. There are a lot of different modalities. Yeah.
Okay. Thank you so much. That was very
You're
helpful.
welcome. Thank you.
Thank you, Sino. I'm glad that you found your answer there. So we hitting our last mile. In fact, we're finishing it off. If you do have another question, please, you have a moment to do that. And both of you connected on Telegram, Instagram. Oh no, not Instagram. Yeah, let's talk about Instagram. You said we can find you on Instagram, right?
Yes.
And what's your
So
handle again?
it's Dr. Lesego Khanzi _ Rain Aesthetics Medical. But if you just look for Dr. Lesego Khanzi, you will find me.
Yeah. Okay.
My logo is green, it's rain. In Tswana, rain is pula, it just means blessings. So that's where it all comes from.
Oh, that's where it's coming from. Nice.
Yes.
But where's your practice?
So my practice is
Which
based in
area? Yeah.
Kyalami. My practice is
Okay.
based in Kyalami in Johannesburg. Quite easy to find. Also, if you just look me up on Google, you'll be able to find exactly where I am. Yeah, so you're very welcome to come and see me. I see people from far and wide. I have patients from the Eastern Cape that travel to come to see me. So anybody's
Oh, you
welcome.
that good, hey?
I think I've just been lucky, but anybody's welcome.
No, that's good. That's so good. Well, thank you so much, Doctor, for sharing that information with us. I mean, I'm looking at the list of the ladies that are connected here. Not a single man has connected today. I'm representing all the men. As usual, we never care about our skins that much. Only a few do care about their skins. And my wife has connected too, so she has more leverage today going forward to tell me to get a sunscreen when I go out. So, but
Yes.
but but thank you so much. Yeah, I mean things have changed really. The climate in particular has changed and has gotten worse, and it's critical that we do take care of our skins, because that's the only authentic leather that covers us, that you can never find anywhere else. So I
Very
guess, yeah,
true.
we should, we should, yeah.
We should. We
Anyway,
have one chance. Let's take care of it.
exactly. All right. Thank you so much for everyone that has joined the show. Doctor, closing remarks before we close out.
So, what I'd like to say is thank you very much for
Mm.
inviting me to the show. Thank you for everybody's comments. But again, please, people, African beauty is beautiful. African beauty is so diverse. Let's embrace who we are. African beauty is amazing.
Thank you. I couldn't have said it better. So thank you for joining us today on NMP Talk Show. We hope that you found this discussion that we had with Dr. Lesego Khanzi very inspiring and very enlightening. Remember, beauty comes in all forms, and it's essential to celebrate and embrace our unique aesthetics. Stay tuned for more engaging conversation that we usually have on Mondays, and let's continue to uplift each other in our journey of self-love and empowerment. My name is Nel Morabedi, the host of NMP Talk Show, and we signing out.